I like that sound. All
Hmm.
right. Welcome again to Watch Your Mouth. With today, we have a really special guest. Um, and we're going to be doing sort of a tag team with her because she
Okay.
has a wealth of knowledge that we absolutely need. Her name is Dr. Jackie Red. Now, she's so well appointed that I'm going to pick the top four things that I know about her from just her CV, which is approximately 87 pages. I'm just kidding. So she was she practiced she graduated from University of North Carolina, A&T, then went on to do her MD degree at University of North Carolina at Chapel Hill School of Medicine. After graduating from there, she practiced internal medicine. She was the chief of gastroenterology and hepatology for adult pediatrics. She was the director of transplantation, C East, at Kaiser Permanente, and finally landed as a gastroenterologist for Mid Atlantic Permanente Medical Group in Rockville, Maryland. Let me introduce to you Dr. Jacquelyn Ray.
Yeah.
Well, thank you for that introduction. I'll just make one clarifying point.
Yes.
Majority of my career is our medical group is the Mid Atlantic Permanente Medical Group, but it's under the umbrella of Kaiser Permanente
Oh my goodness.
all
See, I knew I was
together.
going to get it wrong. I knew
Sorry
I was.
about that. I should have
It, it,
clarified that to you.
it, it was too much information for me to digest at one time.
Okay.
I tell you. So we also have Dr. Calvin. You guys have seen him before. He is our director of strategic partnerships, and he has a load of information he wants to impart on everyone today. So let's get started.
All right.
So, Dr. Brown, I'd like for you to start with the questioning, and then I'll follow up with you.
Okay. All right. So, uh, Dr. Ray, what do you see these days, or what do you think makes it different as far as you being a physician and working with your colleagues versus the way you may perceive as the way that we general dentists try to work with our own specialists? I mean, do you see a difference there as far as how, let's say, you guys communicate versus the maybe that we do it?
Yeah, I'm on the outside looking in, but I definitely see a difference. Number one, our training is different
Hmm.
since when you guys finish dental school, people go on to open their practices.
Hmm.
Versus
Yes.
in medicine, we
Yes, sir.
have to go on to a residency and then potentially a fellowship. You want additional specialized training. But really, in the fellowship and during our clinical years when we're in the hospital, what we really learn is that should not be practicing alone and don't feel you have a group of people around you that can assist you at all times. You should not feel like a cowboy out there all alone. But if you need somebody, ask. If you need help, ask. Don't feel uh, inhibited to not reach out to people. What happens when people then go into practice alone? Sometimes either or with a small group, they might feel very isolated. Um, and that's a difference I see between medical practices and the training at the beginning and dental practices. The second part is when you're out in the world, medicine has become a big, it's always been a big industry, but it's bigger. So you see less of small practices, physicians, and you see them either coming together or being bought out. So
Mhm.
large practices, group practices, hospital-based practices, where you get continue to have that umbrella of people around you, and then but in a person who's practicing in their dental practice alone in a group or small group may not have that big cushion of colleagues around them.
So let me jump on that just for a second. So, do you think it's important for dentists to have a better understanding about their patient before they go into some level of, I would call it always irreversible surgical procedure? And by that, what would be what would you expect going into a procedure yourself? I mean, what would be your preparation? And then we'll dive back around as to what we suspect the dentist should be doing.
Yes, absolutely. Um, as an endoscopist, meaning I do invasive procedures, but you have to have, number one, the knowledge of how to treat these people when you
Yes.
know you're going
Yes.
to be invasive to a person. Um, since I am a physician, I've taken the Hippocratic Oath, first do no harm. So the first thing you always have to ask yourself is this procedure necessary?
Okay.
Because all procedures
Mhm.
have risks. So you want to have that in the back of your mind when you're talking to the patient about the procedure. And you have to discuss the benefit, of course, but also the risk. And people will sometimes say, oh, why are you telling me this? But they have to understand that all procedures
Come with me.
have risk. And so
That's
you
right.
have to have that, the patient be knowledgeable, that they feel confident when they're signing their consent forms, that they understand the benefits and the risk. And then you have to make sure, as a person who is going to be performing the procedure, are you coming at this procedure with your full knowledge, your ability to not only perform what you want to perform, but if any risk complications occur, can you take care of those as well? So you need to
That's a good
come
point.
in with a wealth of knowledge and understanding yourself and stay on top of that because in medicine it changes how you handle certain things, certain procedures, risk. We're getting more and more involved in other ways, so that's very important.
I like that. Dr. Brown,
Mhm.
I know you and I talked at length with regard to the preparation that we either see lacking or that we
Mhm.
really need to see more of,
Mhm.
as if we were, you know, a practicing physician. I mean, we go into these procedures with a very minimal amount of preparedness.
That's true.
Yes, we can absolutely place that implant. That is a
Mhm.
fact. And we know where to place it and how to place it. But there, we're not treating a piece of wood. We actually have a human being that's attached to the other side of that. And they're coming through the door with a level of expectations, just like Dr. Red was saying, of I'm looking for something. You're trying to deliver what we've been trained to do, but are
Mhm.
we falling short somewhere in there?
I actually do think we're falling short, and to me, it actually often starts with, let's say, the consent form. I mean, how many of us really, as dentists, if we're about to do even a simple extraction, do we actually sit there and take the time that the patient fully understands what they're getting on into? Because to me, it's not the mechanical part of taking out the tooth that usually is the issue. It's all those things that can actually go along with it in case something doesn't go the way it's supposed to. So
Right.
in our training, we're so focused on, yeah, that's the consent form. Now let me get and do this mechanical procedure that we're not sitting back and thinking about all the things that are going on that could be an issue. Just this week, I had a young lady that came on in, and she, I didn't do the surgery, but had a couple of implants, there was some failing. She was losing a lot of bone. And long and the short of it, when she filled out her consent form, she put down, she says she thinks she has diabetes. And then when we asked her, what medication she's taking, she says, well, I'm taking a shot, but I don't really know what it is. She's in addition taking a couple of other high blood pressure medicines, of which she says she doesn't remember because she says she doesn't like taking pills. So she doesn't always remember. She'll just take one pill, whatever. So the
Mhm.
whole point to it, this is all about preparation. It's not just a part of just doing a procedure. It's about knowing these things because when we don't take that time to really get to know our patient, understand these things, you know, um, we're more likely to get in trouble. So my whole thing is we as GPs that are getting into surgery, again, it's not just about placing a screw. It's let's slow this down. Let's make sure we have everything that we need. So if something does occur, we don't have to then try to react versus being proactive.
Right. Being prepared is the most important part of everything that we should be doing.
That's
As
right.
Dr. Reddy was saying, being prepared in case something does go wrong. And
That's
it
right.
can go wrong, but
Yes.
are
Mhm.
we prepared to take care of
Mhm.
that portion? So let me just understand a couple of things. Can you prepare and something still go wrong? And if so, how should we be ready for the next thing that might happen?
Absolutely. In medicine, that's why we're always preparing or always thinking about what could happen.
Right.
Um, and
Mhm.
even when we're in an emergency situation, it's not like a regular office visit. They're coming in, you know the patient or may not. Even in an emergency situation, when called in for something urgent, you still have to take the time. That
Mhm.
that few minutes can be critical to you, especially as a physician, especially doing something invasive. The patient might be anxious or may not be able to completely understand, but you know it's an emergency situation that has to be handled. Or even if it's a patient who does understand, maybe their condition is worsening and you really need to act on it, and they you can still get the consent because you have to have a consent unless it's an absolute emergency, but you have to constantly prepare yourself and the team around you. You want to keep yourself fully prepared
Mhm.
and thinking of the complications. Like I said, first, is this the right procedure? Should this patient even go through this procedure at this
That's
moment
right.
in time?
Mhm.
Um, or do I have time to step back, correct maybe some issues first, like give a patient blood before doing a procedure, because you know when you give sedation, it's going to drop their oxygenation. There's steps that you have to understand physically that patient will go through. Do you need to take that time first? And that is understanding. And when you're the specialist or the person who is going to be performing the procedure, even regarding what everyone is saying around you, you have to take that moment, or more than a moment if you need it, to make
Mhm.
sure, is this the right procedure, the right timing to do this procedure, and do I
Right.
have all the elements
That's right.
around me, the staff around me, to perform this procedure safely for the patient?
I like the way that
Mhm.
you actually phrase that, because that seems to be, there's a rush in dentistry to do these implants. Like, I just want to get them done. I want to do a million of them.
Mhm.
And so, you and I, we all know, the more you practice, the more chances there are that something may go wrong. It may not go terribly wrong, but if you're prepared for the terrible, then you're prepared for everything else in between, what should happen and what might not happen. And it doesn't seem, from some of the cases that I've seen that have actually come in the door, it's alarming. And that's one of the reasons why we're talking about this today. That's why the reasons that we have the Substack, because we're really trying to bring everyone along. We're not, like I said, this is a safe space. So we're
Mhm.
not trying to admonish anyone or just say, oh, you terrible dentist. We're saying, wow, just slow it down for a minute.
Mhm.
Let's look at what we're doing. How in the world are we supposed to say that we do surgery and
Mhm.
we take out a 15 blade and cut someone,
Mhm.
and we haven't done it, even just a PT or PTT? We don't know how they're going to respond to the procedure itself. We don't
Mhm.
know the A1C. We have no idea about anything about that person. We have a minimal idea about the drugs that they're taking, but we've
Mhm.
not done a full polypharmacy to figure out which one of these drugs are going to impact what we do, impact the healing, and impact the outcome. And those are the things that, once we place that implant in and we take that first x-ray, wow, it looks fantastic.
Mhm.
And then the human body begins to remodel. And
Mhm.
we haven't taken that into consideration, because it's like when they come back in, we say, come back in 30 days. And in 30 days, you see these craters, you see some pus, you see this, you see that. And you say, oh, what happened? If you must have done something. You're talking to the patient. The patient's like, I've been doing the same thing I've been doing. But you never even asked me, could I walk up a flight of stairs? You
Mhm.
never, just the basic things that we should be doing. Can you walk up a flight? Can you pick up your groceries, make it to the front door? Are you out of breath? Do you have to stop? Those are just simple signs that we can kind of pick up along the way to get before we start saying, I need to know a little more about you. And then once we start drilling down just a little bit, you find out you need to drill down a little bit more. Get some blood work, make sure you have a CT scan and a CBT scan. If you have
That's right.
both, get them. And then start to really do an analysis because they're not running away. If they came to you, it's because they trust you, not because you got the best deal this week. So you
That's
really
right.
got to take that time, sit with them, and give them, your point of view, and let them have an opportunity to really digest what they're going into because it is a really serious surgical procedure. I
Hmm.
mean, how many times can I tell you I've seen implants in the mylohyoid space, and I'm just like, how did you do that? But
Hmm.
it can happen, right? So I'm
Hmm.
not saying that it can't happen. I'm just saying that, but it did, and then it presents itself, and you're like, but there's certain things we're supposed to be doing along the way.
Hmm.
But I'll let you go down.
Yes, as a matter of fact, you think about like the difference between, let's say, the dental mindset versus the physician's mindset is I'll never forget the book in school, Medical Emergencies in the Dental Office.
Mhm.
And I was like, huh. So we have this whole book written about all of these things that will happen in the dental office. When you're not actually thinking about it is how can we really prevent those in the first place? And we can prevent those by doing the basics of what every surgeon would do before they're doing an invasive procedure. So that way, if something does happen, we're not shocked. We're not running around like chickens with our heads cut off, trying to calm down and say, okay, 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 now what are we going to do? You know, we can find these things out long before we pick up a scalpel, long before we do any of these things, any of these invasive procedures. So I know now, you know, since Doc, ever since being with you, is that there's the old theme of, well, if you know you can now do something better, why would you not do it? So it's like, as you said, this is not about chastising dentists and saying, for shame. This is nothing about those things. It's something about is an evolution of what we're working towards. And my whole thing is that one of the reasons why I've been sharing with my friends the Substacks and what we're writing is it because a lot of this, at least from our profession, is relatively foreign. Maybe if you're an oral surgeon, you're a little bit more used to this if you're doing things in a hospital. But I think often when even some surgeons, we get back to our offices, it's kind of like we kind of treat things a little bit differently. It's because it's just, I think it's part of the nature of our training here. And so I'm getting to the point in my career that when I think of something like medical necessity and, like when we talked about, let's say, sending our friends to Substack, I've had some of my colleagues say, yeah, well, okay, well, this means now you're going to teach me how to medical bill. And I'm like, medical bill? I said, no, no, no. And this is a phrase I kind of came up with is that, medical necessity is not it's not a billing phrase, right? It's not. It is the clinical story of why we're treating and the decisions that we're about to make. Oh yeah, then maybe down the line you can get into all that insurance stuff. But it's a developing mindset. And if like as you always said, readers are leaders. I've had some
Mhm.
doctors even this week say, "Yeah, okay, so you guys, does this mean all week we can metal bill?" I'm like, um, you're missing the whole point there. If you can't take a few minutes to read a 5-minute article, do you really think you're going to want to sit there and take an extra 15 to 20 to make sure that certain things are done for their patients? I'm not saying it means they're bad people. Is that
Right.
it's just a mindset. It's a mindset.
We're trying to put the brakes on everybody. Just slow
That's
down for a
right.
second
That's
and
right.
get to know the patient. I have a phrase in my office which I think is a little wonky, but it's me. I don't want to treat anybody that I don't want to see in a grocery store, which means I have to get to know you. I don't want you to surprise me with, oh, by the way, I'm taking, oh, you didn't know that?
Hmm.
The
Hmm.
things that
Hmm.
normally go on. So I spend that time having sort of a Marcus Welby, MD. I just kind of sit there and talk to him. And by talking, I get more information, which leads me down the family history. And then try to figure out, okay, the implant procedure, I guarantee you, Mr. McGillicuddy, I can do it.
That's right.
The goal is for you to survive it. And so here's the
Hmm.
things that I need to do. and let's talk. And so all of a sudden, the medications that they're taking, they weren't prescribed recently. They've been
That's right.
sitting in the medicine cabinet for the last 8 months, sometimes
Hmm.
for a year. And when they have
Hmm.
a little cold, they grab this pill. And when they have this, they take this. I have a pain, I take this. So when you say, are you taking anything new? They say, no,
Hmm.
I'm still taking what I've been taking out of the cabinet. Well, I don't see it in I look in your medical history, I don't see it.
That's right.
Oh, well, that's because Dr. J gave it to me 3 years ago, and I didn't take all of them, so I use some of them now. And I know these were for my gout, and this one. So, oh, you have gout? Well, yeah, I used to have gout. It doesn't bother me anymore.
That's right.
So we're in that boat. But all those things affect the outcome of what we're doing because
Hmm.
our success is in millimeters. So if we lose these precious millimeters, well, we don't have that many left. We're only using 11,
That's
maybe
right.
13. I routinely try to use at least 15 to 16, so I have a little more space for something to go wrong. But everyone runs
That's
with
right.
the 8 millimeters, the four, and it's okay.
Hmm.
It works,
Hmm.
but then you have to really concentrate on that margin. You
That's
don't
right.
want to lose 1 millimeter a year and you have an 11 millimeter implant.
That's right.
So you know
That's
that
right.
because that was the thinking. I went to a convention, Jackie. I'm not kidding. This is incredible. I was at a convention. The guy said, "Oh, we're going to lose at least 1 millimeter a year." I said, "How long were your implants?" "Oh, they're 8 millimeters." I said, "Okay, so you're planning on them coming back." because, and so it's almost like just making someone think about it, about what you're saying before you say it, and think about the person that you're putting them on. They want
That's
to
right.
have these things for at least that smile, that level of confidence. And believe me, when those implants go in and the teeth go on top, that person becomes they metamorphose into someone entirely
That's
new,
right.
Yeah.
That's right.
and they will metamorphose back
Hmm.
to that person you would never believe they were. When those implants start to come out, you'll be like, who is this? I
That's
didn't
right.
know this. And
This
so
angry person all of a sudden. That's right. I get it. I've been.
That's true.
so so go ahead, Dr.
I
Red.
would add one thing kind of to tie this into like the medicine part of it, which is critical, um, is I always think about a couple of things. You can't tell a book by its cover. So I think when you're thinking about, what issues, that's why you have to ask a person what issues they have. You can't assume they don't or they do have issues. There are a lot of people who walk around that look perfectly fine and you don't know what's going on the inside. And
Hmm.
so, like you're saying, and what you're trying to implement is getting the dentist in the habit, the comfortable
Hmm.
habit, not just a habit, but the comfortable habit of inquiring before you proceed with an invasive procedure or a surgery. Um, like I will say, just given my background, an example that I would use is like liver disease. I think people think
Yes.
of liver disease, they think of an alcoholic. Oh, I'd be able to tell that. I know the person, I don't know the person, and you worry about that. But what we're finding now, a big driver of transplants and liver disease, or something you may not see in that person, and that's that non-alcoholic fatty liver
Hmm.
disease, which
Hmm.
drives a lot of new transplants these days. And you say, oh, they would look a certain way. Well, some might not. Again,
Hmm.
you have to ask those questions and just see. And if a person can't respond, then you really need to take that minute to say, well, can you get a note from your doctor or get
Right.
some kind of
That's
data
right.
to you?
Hmm.
You shouldn't just like, oh, they didn't know, so brush it off. No, because no one's going to
Hmm.
accept that in the realm of when it fails or
Mm.
something happens, a complication happens. No one's going to accept. Well, I just didn't know.
That's true.
It just sounds so defeating to say.
Yeah, I agree with you 100%. I Let me ask you a simple question. They're all simple questions to you because you. But what what is a minimal lab panel? Let's say for our audience to just sort of think about, you know, what would you normally do in your practice?
The minimal, I would say the minimal lab panel would be blood count and
Hmm.
Mhm.
just basic electrolytes.
Yes.
with the kidney function, with what we call a Chem 7. Some people call it SMA 7. There's different terms
Hmm.
for it.
Right.
But it's
Right.
just a Chem panel. You want to know electrolytes, BU, and creatinine, and a blood count. Okay, blood
Yeah.
count gives you not only the blood count, but it gives you white blood cell count, and it also gives you platelet count.
Hmm.
And so that's very important. That would be like my, basic panel. Most people, unless they are on a medication that you're concerned about for blood thinning, you don't necessarily have to get that. We can, I mean, in the medical field, it's very easy. And that you could do that, a PT, but or an
Hmm.
INR. But really the labs, if you're not following the patient on a regular basis, would
Mhm.
or get it mailed over from the doctor. One of the things that I personally have enjoyed in my years in medicine, my 30 years practicing, is seeing the development of use of computers. It helps keep it legible, number one.
Right.
For me reading my own notes, someone else's note, or the nurse looking at the notes, or the pharmacist. I mean,
Hmm.
you look when we're putting in orders nowadays, it's very electronic. The use of a prescription pad is becoming antiquated in a lot of
Yeah.
ways.
Hmm.
A lot of pharmacies don't even take a
Mm.
handwritten uh, uh, prescription. So that's also helpful. But the sharing of data. So
That's
every
correct.
time a person goes somewhere, oh, I gotta get those labs all over again. I get those labs, and the patient feels that, you know, financially and physically, for the constant repetitiveness
That's
of
right.
data
Hmm.
that they have to present. They assume we're talking to each other. We
Right.
do talk to each
That's
other.
right.
We pick up phones all the time. So sharing of that same information electronically, so you can know that it is clear and concise and you didn't hear it wrong or you were thinking something else, is critical again for
Hmm.
errors, because that's the other big big kind of ugly person syndrome. You don't want medical errors to come into play either before, during, of course, the
That's right.
procedure or surgery,
Hmm.
and
Hmm.
anything that might disrupt it afterwards.
Yeah. I think the minimal labs are important because sometimes we just do blood pressure and say, oh, they're okay. But then
That's right.
I'm saying to myself, why did you do the blood pressure? Because are you doing a graph? Are you concerned that maybe the blood pressure has been high for so long, there's not enough oxygen in the capillary beds to continue with that graph? So I say
Hmm.
that kindly because I'm like, what? Well, why did you do it? Just because to say, like check a box. I did blood work. I did this, not even blood work, just blood pressure. And I'm saying
Hmm.
those are things that we need to understand.
Yeah.
Some of the things that we do them for the procedures we're about to do. Because if you're not going to be aware that the person, their hemoglobin is low, well, they don't have oxygen carrying capacity to bring anything to healing in the rate that you want. I
Right.
mean,
Hmm.
so we're talking about the basic things that they should be looking for. So when they
Hmm.
say, well, they haven't healed yet, well, I didn't. They're not diabetic, but yes. But suppose they're anemic. Suppose
That's right.
there's just not enough, or suppose that there's too much iron, so that they really can't carry oxygen. So wait, like, and they say, oh well, I didn't do all of that kind of stuff. Yeah, but it's something that we know.
Hmm.
We just, if you don't, it's like I took French for 8 years. Yeah, try me. I don't even know. I can't, because I've never said it anymore. I can't say a French word. Parlez-vous français. I don't even know what that means anymore. Right. So we've all done these things,
Hmm.
going through medical school, dental school, we've all done it. But if we're carrying the water for something else, right, we're gonna miss what we're trying to do. That's the majority of this conversation. That's why I was so glad you guys could get on. I think it's
Hmm.
just, but Doc, you were gonna say something?
Yeah. Well, thing about Terrence, what you just said is, and we're talking about, well, we'll do blood pressure, okay, which is something is very basic. And they were like, we rushed to our procedure. Like you said, I even had the same lady I was talking about. I asked her A1C. She asked me, well, what was that? Okay, so if she doesn't know it,
Right.
how is that going? If she doesn't know it, And we're not really sure what that means or how that's going to affect maybe how a patient might heal. This is where I think part of the problem is. I honestly believe that yes, most of us dentists, we, and maybe some point in dental school, we've heard about these things. Maybe the first couple years of school, then there was immediate rush to the clinic the last couple years so we can get and do all of these procedures. I just think now that having these type of conversations now is going to help elevate our profession because I believe that many of us actually really want to do better. And we ask the simple questions of, well, okay, yeah, well, you took blood pressure, but there are certain other things in the blood, is it oxygenating enough? Well, we all know that two things that a wound needs to heal at least is oxygen and some stability. So if we don't know these things and we're placing all these screws into somebody's head and then it starts losing bone and having these other issues, we're getting to a point now where we can know why by simply just getting some lab profiles. Because lab profiles are pretty much going to tell us, everything.
Huh. Mhm.
And so once we start doing these types of things, we can then provide not only better care, but better answers for our patients. Because, like as Dr. Red just said, yeah, there are going to be times that no matter what we do, there can still be an issue. But
That's
I don't
right.
ever want to have to say again, as a medical professional, which is what we are, as I just don't know why when if I took the labs are basically like pointing to me and almost convicting us and saying, but this has been like this. And I don't
Mhm.
have to say, oh, well, I'm a dentist, we don't have to do that. No, those excuses, those no,
They
those are
don't
starting to go
carry any
away.
water
Yeah,
anymore.
they're going away. They're going
Mhm.
away.
Yeah. I think sometimes when we've gone from crowns in a day to implants in a day, and the
Hmm.
whole concept of cosmetic dentistry is nice,
Yes.
and it doesn't require it requires more manual skill and the eye perception of seeing how something should look in the mouth and make it look beautiful.
That's
But
right.
when you combine that with a surgical procedure,
Hmm.
you crossed over from dentistry where it's kind of a safe zone, a gray, the side of the road
Hmm.
where we're riding down the highway, we're okay in this space. And chances are we may not have a whole lot of problems that may happen to us. But
Hmm.
when we start crossing over into the surgical aspect of what we're doing, it's almost like we're going down a one-way street with no headlights on in the
That's right.
wrong direction and hoping
Hmm.
nothing happens. But
Hmm.
we know something's going to happen, and you
Hmm.
don't want it to. So we asked, like, look, well, doc, that's what someone said to me. I only do crowns and whatever. I said, well, do you use a syringe? I mean, are you using, carbocaine, lidocaine, is it amide? Do you know if they have an active kidney or chronic kidney disease? I mean, because then you're giving it and it's being processed in the kidney. Is that something that you're going to cause a problem with? And so they said, well, yeah, it could happen, but it probably won't. But I'm not saying that to worry about every little thing. I'm just saying know
Sure.
the majority of the things that could possibly go wrong. So when you walk into a procedure, whether you're doing a crown, veneers, or implants,
Hmm.
you are prepared,
That's right.
right? You're prepared.
That's right. That's right. I would even say too, and even just keeping this simple, is that many of us, even as general dentists, we've taken out a tooth, and we said, oh, this patient had a dry socket, and it takes 2 or 3 visits for the patient to keep coming on back, and we keep slapping that paste into it or any number of other things, and then eventually maybe 30 days, maybe 40 days later, the hole kind of closes over, and we're like, oh, okay, well, took care of that, not realizing that why did it take so long or what was
That's
going
right.
on in the first place. We may say, oh, the patient lost a clot, but it may not be that simple.
Mhm.
So just as something as simple as a procedure that we do all the time is the very basis that if you're going to do this, yeah, right, maybe most of the time everything's going to be fine. But if you practice even as long as I have, which is Dr. Red, more than 20 years, you're going to run into something where maybe that one night you're wondering, oh goodness, what happened with this patient? Usually it's okay, but if you've done this long enough, you're going to run into this. And now, by doing a situation where I can get my basics in the beginning, talk to the patient, just like as you said, doc, I want to make sure that if I'm walking into the grocery store, if I see Mrs. Jones, I don't have to walk the other way because she had an adverse event that I maybe could have prevented, but I did not because I just wanted to do a procedure. I want to slow it down. I want to, minimally find these things out. So that way, then at least if something does, or before something happens, I can simply have that conversation with my patient. I like talking to people. I like talking in such a way that I can have this conversation so that I can, not only develop trust. I like the old situation of kind of laying on hands where you get to know someone. And
Exactly.
then once we do all these things, then I'm like, okay, you know what? I'm going to do your procedure for you. That, and I know in medicine, that's usually the way it is. This rarely, unless there's an absolute emergency, you're not on the table that day. They don't take your insurance. Oh yeah, I can fit you into the chair for something. No, you're going to have to go through some things. You're going to have to.
Mhm.
If you like had a close family member had blood drawn not too long ago, something's pretty minor. Go to another specialist. Well, that specialist saying, oh well, we need to draw blood for basically the same thing. So nobody's talking to each other. So this situation that we're working in with DentRx, it gives us a chance to take all this information and put it to a space so that we can take that time to have that conversation and then say, you know what? Now I think you're ready for surgery. We have everything that we need. If not, we can refer. I can refer my patients to Dr. Red because the patient say, yeah, I have GERD, but I'm taking all these drugs and yeah, I'm taking this and I'm taking that. Well, how's it working for you? Oh, I'm still coughing the stuff on up. Well, we won't do implants, we'll do crowns. We're still not finishing the fact that they're having a problem here. Let's manage the medical part first, and then we can go on from there because, like as you said, most of these patients they're not going to go away. But I don't want to create a situation that because I was hasty, that they're going to stay for me for a very long time. Every time they call, I'm like, oh, that person's calling on the phone. Oh, there's ways that we can avoid that by simply just slowing it down a little bit.
I think health professionals also come to realize the longer they practice, I see the difference between people early in their practice and later in their practice. That number one, it's okay to take a
Hmm.
minute, like you say, to slow down and think
Mhm.
about things. As everything
Hmm.
doesn't have to happen at that second. Number two, you'd be surprised how patients don't mind that. People think
Right.
I got to get this done. Like it's like it happened this second. It's not a delivery. It's like the patients don't mind. It's like, okay, I'll get that done. That's no problem.
Hmm.
And they're very
Mhm.
they're very thankful for that. And along this whole line, keeping in mind the practice of medicine and dentistry are constantly evolving. We're
Right.
finding new ways to do things,
Hmm.
better ways to do things. And so that includes drugs, that includes therapies, that includes, procedures. And people, patients, who are people, um,
Hmm.
always think we're talking to each other anyway. So taking the minute to not only speak to them about the whole picture of what they should be expecting,
Hmm.
but number two, saying, having no compunction, say, well, let me run this by. I have a dental surgeon who's excellent, but I just need to run it by and what they think about this. That's
Hmm.
Right.
okay. You don't have
Hmm.
to be I'm the hero here.
That's right.
Patients at the end, a person, I'm a patient and I go to the dentist or to see a physician. I'm on the patient end on the other side too. And I
Hmm.
know and I know what I'm thinking at that moment. Take your time. Go ahead. You
Mhm.
can
Mhm.
consult with someone. We can get back to
Hmm.
it. Because in the end, patients just want an experience
Right.
That's right.
that is a good experience for them. It's already hard enough coming in, presenting with not feeling well,
That's right.
and in the end, you want to feel better, and you keep back and coming to the person makes you feel better, and then that's what people want. They just want to get better
Hmm.
and it not create other problems. And
For
I
sure.
always practice that I treat everybody the same. I don't
Hmm.
people come and say, "Oh, you how to treat me this." I said, "No, I can only treat people who want the same way.
Hmm.
It doesn't matter
That's right.
because I want them all to be treated respectfully, and I want an exceptional outcome in the end.
That's right.
Right.
That's it."
Hmm.
You know,
Just
I I just love the demeanor that you have, doctor. You could be my doctor, uh, because
Yeah, mine too.
it is it's you know you're nervous. I listen. I when I go to the doctor, uh, I go and I'm like, all right, doc, take your time, tell me what it is, but you got to be careful, man, because I might pass out on you. And they start laughing, right? Because I'm like, look, it is if I'm nervous and
Hmm.
I'm because you're going and you're like, oh, I don't want to hear any bad news,
That's right.
but I'm prepared for it if I have to. And so you go the whole night thinking, what do you think they do when they come see us? Oh, I'm just glad to have you stick this needle in my jaw and do all this work.
Right.
No, they're nervous. They're
Hmm.
Right.
scared to death. So
Hmm.
if you rush them in and rush them out, all they feel is hurry.
That's
Hmm.
right.
That's
Hmm.
it. And then anything that goes wrong is because he hurried. He
Right.
just slowed down and asked me,
That's right.
was I going to faint when he pulled the needle out?
Hmm.
I wouldn't have pulled it out in front of him. I would have given him
Hmm.
a
Right.
chance to do whatever. But I want to alley oop this last two questions to you guys.
Okay.
And, it's with the invent of this online pharmacology and these medical drugs coming in all directions, we have proton pump inhibitors, SSRIs, GLP-1s, semiglutide, triglutide, quadriglutide. There's so many things, and some of them don't go through the pharmacy. They'll go through these online platforms, and then the patients
Hmm.
have it, and they're taking it and say, "Well, it's really not, I'm not. It's nothing. I'm not. It's not important." And so when we're thinking about that, I always in my mind, I look at some of the patients I've seen. I've seen thousands and thousands of patients, and I've
Hmm.
seen different people walk in looking like Charles at last, and then they have the most problems. And then someone who walks in and looks like me, they have few problems. And you can't judge them by what you
Hmm.
see. They
Hmm.
have drugs now that hide, they're called antiviral. So even when you do the blood work, you're going to miss it unless you call an internist like Dr. Red to say, this looks normal, but it doesn't seem like it's quite normal. And so all of a sudden they tell you something that you're like, oh, it's a drug that got you. Okay. And now
Hmm.
you go back and you run another test and all of a sudden you find it, right? So I want you guys to just
Hmm.
work that in for me. And then give me your what one bit of advice you'd give to everyone out here. So we start ladies first, and
Okay.
Okay.
then
The best advice I would say is that as much as the patients think that you will know everything, you cannot.
Hmm.
You cannot with help. Okay, let's put it that way. In that regard, and that's fine. But you have to grab the help that you need, be it if you're using something to help you make sure the medications are can interact. I mean, in medicine now we have a lot of systems that have been put in place. Drug interactions are very critical.
Hmm.
Not only with people who have allergies too, and that's the first thing people always ask you. But now drug-drug interactions are very important. But the only way you can pick up on those drug-drug interactions is basically by knowing their drugs, like you said.
yes,
And not only the drugs per prescription, but I have to throw in over the counter, all these, people are inundated online about all
Hmm.
these, take this and, make this perfect, and then your nails will grow and everything will happen to be perfect. So also those over the counter supplements are very much to have interactions with medications, well known prescription medications. So that's very important. So a system which we have in medicine very much. Since I'm in a big group practice, um, there this is what we use. You have to depend on these things because you'll miss it, and that's okay. That's not a fault that you can't remember absolutely every drug interaction. Even if you go to the pharmacy, they're going to the computer first and saying, okay, let me check on that. So
Hmm.
don't feel like that you shouldn't, that's something wrong to do because it's always right to check. And so putting some kind of helpful system in place to help you reduce, again, any risk to the patient or any potential complication because it was not picked up beforehand is always going to be appreciated at the end.
That's right.
Yeah, my whole thing now is, and I kind of hate to keep kind of harping on this, but is I'm learning to, because I'm knowing more and I'm knowing how to do things better. I think that this is all is very important. I'm not judging anymore, and I think unfortunately a lot of us dentists do this, is that if we don't have, you know, 8, 10, 15, or 20 patients on our schedule, we're like, oh my goodness, I'm not a very good dentist. And, as you get older and as you start practicing a career and you practice and done as many surgeries as I have, I'm starting to realize, you know what? You don't have to have that many patients on your schedule, to do what you want to do. My whole thing is it's becoming less about just trying to rack up these procedure numbers and just saying, hey, let me get to know my patient. Let me get to know what's going on. Let me get to know all their medications and everything that's going on because that's very important. I mean, there's something in the news right now where I think maybe 4 patients happened where, one was given the wrong drug and then 3 others were given something they were allergic to. And it's just so, these things, unfortunately, they can happen. I know that at least as far as being a dentist, one of the things that even I had to fight is that why do many of us want to become dentists? Because we want a solo practice. We want to be in our own worlds. That's okay,
That's the truth.
but as far as with technology now, there's no reason why I can't have access to what Dr. Red does or to what the patient's PCP is. I want now because I know, but I want all of these records before me so that before I start doing this procedure, because implants now is a very common procedure. Everybody's losing teeth, everybody's getting implants. We're inundated with either take these new medications for this function or for losing weight on the internet that don't even go through regular pharmacies anymore. To these patients are now we're throwing at them, get these arches done, get these implants, get this, that. We can do this. We can approve you in a day. All these other type of things. I mean, that's from a procedure standpoint, that's fine. But I just know that for myself, I want to just slow things down a little bit. I want to know what's going on. I want to do the basics that Dr. Red would do before surgery so that I just have some more information. And all it's just going to take is just a little bit of time, not a whole lot of time, just a little bit. But that time is what makes the difference about as far as make sure your patient has a better chance of healing the way they should. And if anything, I just want to be able to sleep better at night. And I know that if I can do that by just slowing it down a little bit, man, to me, it's the best thing in the world.
Well, I want to thank the both of you for everything that you guys have imparted today. I 100% follow you guys. I think it's absolutely. I see 4 patients a day. I only work 3 days a week. I love what I do. I enjoy it. Now, I'm not saying that's not for everybody. I am a little bit older than most of you. But, I'm enjoying this part, and that's why we're trying to give this information to someone to say, look, there is that place where you can have at least 2 or 3 touch points with different specialties and internists and gastroenterologists, just touch points, something that you could do very quickly because all of this electronic media we have, just because we like to be in that solo place. I don't want anybody to tell me anything.
Mm-hmm.
But we need a little bit of advice. We can't operate in these silos forever because there's so much information that's passing us by. So if you can have at least 2 or 3 touch points a day with different, physicians or different specialties, you win.
That's right.
Because and the patient wins. Yeah. And you can go home and get that good night's sleep we were talking about.
That's right.
So anyway, I thank you both for being on today. This was fantastic. I think our audience is going to love it more than really. And it's a captive audience because it's just doctors just like us.
That's right.
And we're having a real conversation. So anyway, I thank you guys.
Thank you, Darren.
Perfect timing.
Yeah, thanks, Doc.
Promise you this time I'm going to hit record. So I will definitely